Africa is pushing ahead with plans to roll out national health insurance. It is expected to make public health care more accessible and affordable. Pretoria's current system is under immense pressure and is in desperate need of improvement. Sumitra Nydoo reports from Johannesburg.
Healthcare doesn't come cheap in South Africa, and the quality of care depends on affordability. State facilities are only free to those who are unemployed or earn less than $500 a month. But most of these facilities lack sufficient equipment. They are badly managed and heavily overcrowded.
I see healthcare becoming more and more costly, more and more expensive, and furthermore out of reach for your ordinary person in the street, especially those who are uninsured. So they have to fork out just that more money to be able to afford to see me and even to be able to afford the drugs.
The government is determined to change this. Policy plans for national health insurance were first revealed back in 2011. The ambitious plan is aimed at providing quality health care to all residents of South Africa, even to those that cannot afford it.
The concepts, I think, are to improve the amount of money that's available to fund healthcare. Secondly, to improve the delivery of healthcare through the public healthcare system, so improve the management and functioning of the clinics and hospitals. And then thirdly, to use some of that extra money to contract with private providers, for example, private GPs, private specialists or private hospitals, to provide services to everybody.
Currently, several pilot projects are in place as part of the rollout, but the full implementation of NHI in South Africa is expected to take up to 14 years before it's complete. Currently, South Africa has a two-tier system which consists of public health care and private health care. NHI will introduce a one-tier system, but there's still little clarity on how it will work.
We still don't know the exact timetable, nor do we know the exact details of how the NHI would articulate with medical scheme coverage. It's going to be aimed at the entire population, not only at people who have medical aid today, which is probably about 17 or 18% of the population. Our best guess is that you'll have NHI and people will still continue to belong to medical schemes at the same time.
It's a daunting task, free healthcare for 56 million people. In order to get NHI to work, service delivery in the public sector needs to be significantly improved. There also needs to be a bigger buy-in from private doctors and hospitals.
We need more doctors. For that to work, we need GPs like myself to leave my comfort zone here and then to go and work in a NHI or public sector clinic to alleviate that. The public sector, I think, is in a bad state, for want of a better word, for a number of reasons. One, there are too few doctors, too few resources, and just too many people.
Doctors and specialists are still leaving South Africa in search of greener pastures. It's feared the introduction of NHI will see even more medical practitioners leaving. However, many experts believe that NHI will work and provide a more fulfilling platform for those doctors that really want to make a difference and in the end give poor people the healthcare they deserve. Sumitra, Nydoo, CCTV, Johannesburg.